I'm Dr. Julie. Welcome to my channel. I'm a board certified psychiatrist practicing in Georgia. And here on this channel, our mantra is we meditate, mobilize, and work to manifest the things that we want in life. I'm back this evening with my Psychiatry Frequently Asked Questions series. So we're going to jump right in. Before I do that, just a reminder, this information is for educational purposes only. It doesn't substitute for medical or mental health advice. And of course, if you have any questions, you should always contact your primary care provider, therapist, or psychiatrist. Okay, so what does it mean to be addicted to a substance, and can that happen if you take psychiatric medication? Before we jump in, it's important to have a little bit of vocabulary to understand the discussion of this topic. So one of the terms that's important to understand is called tolerance. What does that mean? Tolerance basically means that over time, you require more of a certain substance or behavior possibly to get the same effect that you used to get. So let's take alcohol for an example. Let's say you used to drink 5 to 6 drinks and you would get a buzz, but now you have to drink 8 to 9 drinks. Well, that means you became tolerant to the lower dose. You need more alcohol to get the same effect that you used to get at a lower dose. So that's tolerance. Then the next topic, the next term is dependence. So dependence is a physiologic and emotional state that is associated with withdrawal syndrome. So let's say, again, we're going to use alcohol as an example. You've been drinking alcohol heavily for a long period of time. Then you try to stop it abruptly. Just one day you go cold turkey and you say, I'm not drinking alcohol again. Well, if you did that, potentially you could develop a withdrawal syndrome. And that would mean that in terms of alcohol, you could have the shakes, you could have the sweats, you could feel depressed. And in some cases, you could even have a seizure, and the seizure could be potentially life-threatening. So not all withdrawal syndromes are life-threatening. Generally, they're pretty unpleasant. They're not all life-threatening, but alcohol is a situation where it can be potentially life-threatening. So if you have been drinking alcohol heavily for many years, for example, you would definitely want to seek the assistance of a medical provider to assess whether you're at a high risk to have a withdrawal syndrome. So withdrawal syndromes are associated with your body becoming on a substance or a behavior. I didn't give an example just now, but I will. So let's say if you're gambling and you've been gambling for a really long time. For some people, if they were to stop gambling, they may have some of those same symptoms. They may feel irritable, they may feel depressed, they may feel kind of confused. They may really have a lot of cravings to go back and gamble to get the feelings that they used to have. So typically when we think about a withdrawal syndrome, we're thinking about something physical, but there is a psychological component also to withdrawal syndromes in being dependent on a substance or a behavior. So let's go to addiction. So in psychiatry, when we talk about addiction, we're talking about a complex disorder that includes physical components, it includes emotional components, social components. So it really is a multi-layered condition. So how do you know whether you become addicted to a behavior, an activity, or a substance? So typically addiction is going to be associated with a negative consequence of some type. So what we see often, if I'm treating a person who has become what we would say an addictive disorder, they have that. I'm thinking about a person who is spending a lot of time trying to engage in a certain behavior, or they may be spending a lot of time trying to get substances. So for example, maybe people are spending every free moment they have at a casino if they have a gambling problem. Or if maybe they have a problem with cocaine, they're spending every minute they have trying to get money to get cocaine, or they're engaging in negative behaviors, maybe like shoplifting or stealing from family or prostituting, things of that nature to get money for drugs. So addictive behavior may not start there, but it can definitely potentially end with those kind of behaviors that have a lot high potential for negative consequences. When I think about people who are addicted to, let's say, prescription medications, behavior I may see is they may seek early refills. They may doctor shop. So they may try to go to different doctors to get multiple prescriptions because, again, they've developed tolerance. So they got to have more than medication to get the same effect. So they may be engaged in those kind of behaviors. Typically, people who are addicted, if they try to cut down, they have a hard time. So even when they recognize that there is a problem happening, it's hard to stop what they are doing or to cut down on what they're doing. And oftentimes too, let's say they'll try to give themselves limits. Oh, I'm only going to gamble with $20, but they end up gambling their whole check. Or I'm only going to have 2 drinks, and then they end up, drinking 2 to 3 bottles of wine and being totally snowed. So when we're talking about addiction, we're talking about a multi-layer behavioral, physical, social disorder that at the core is going to have a negative impact on your social life, your work, your physical health, and your relationships with other people. So why is it important to have that discussion about tolerance and dependence and then an addictive disorder? So in my practice, when I'm talking about addiction, I really only use that when I'm talking about a person who's engaging in some of those behaviors or having those negative consequences. But often I think when patients are asking me about becoming addicted, they're really worried about becoming tolerant or becoming dependent and having withdrawal syndromes like I talked about earlier. So those are really different things. So for example, I can prescribe a medication and you can become tolerant to it, and you can also become dependent on it to the point where if you stopped it, you may have a withdrawal syndrome. But that doesn't necessarily mean that you have an addiction. That doesn't mean that you're taking it inappropriately or you're engaging in negative behaviors. So tolerance and dependence can be just a natural consequence of what happens when you take certain medications. So in psychiatry, for example, people who take stimulant medication, like to treat ADHD, Ritalin or Adderall, that is an example of a medication that people can become tolerant to and dependent on, even if they're taking it the correct way. That doesn't mean that they have an addiction. Those two things don't go together. So that's why it's important when we have the conversation and to answer the question that you have an understanding of those concepts. So yes, you can become addicted to a medication. You can start taking the medication and overuse it. You can take it other than how it's prescribed to you. So that is possible, but most psychiatric medications aren't going to cause tolerance or dependence or be something that's really abusable. Now, people can abuse anything. One thing I've learned over being a psychiatrist as long as I have, people can abuse or take things inappropriately. But for the most part, most classes of psychiatric medication don't have the potential to cause what we are calling an addiction, what I have described today as addictive behavior. Can they cause tolerance and dependence? Yes, that is possible. And there are some medications that don't necessarily cause tolerance, but they can cause withdrawal syndromes. So there are some antidepressants, for example, I prescribe that the way that the body metabolizes those or uses it up is that if you stopped it again abruptly, you can have a withdrawal syndrome, even though you may not be tolerant, and you can still have withdrawal syndromes too. So it can get confusing in the discussion, because typically people in the community, when they're talking about addiction, a lot of times they're meaning what I'm describing as tolerance or dependence. And those things are normal physiologic or physical processes that don't necessarily have to have anything to do with addiction. Now, it can be involved with addiction, like I talked about in the alcohol example, but they aren't necessarily the same thing. So tolerance and withdrawal syndrome kind of over on this side, and addictions here, and they are related, but they don't have to be. And that's important. So when I prescribe medication to someone and it has the potential to cause tolerance or dependence and withdrawal syndromes, I have to tell the person, hey, I think this would be a medication that will work well for you, but if you take this every day over time, you could possibly become tolerant to it. And then if we wanted to stop it, we would have to wean it, because if you stopped it abruptly, you could have some negative consequences. It is important, I think, to ask your doctor when they're prescribing you things if that's possible. But also to know the vocabulary. So when patients ask me, can they become addicted to a medication I prescribed? Almost all the time the answer is no. But the answer might also be, but you can become tolerant to it, or you may become dependent on it, which has the potential for you to maybe have a withdrawal syndrome. Now that might be true, but most of the time the answer to the question, doctor, will my psychiatric medications cause me to become addicted? Almost all the time the answer is no. how can you help yourself if you have an addiction history? It's important if you know you have an addiction history, whether it's to gambling or alcohol use or other substances, to let your doctor know. So in my case, if I have a person I know has a history of an addiction problem, I may be more cautious if I'm prescribing something that may cause tolerance or dependence, right? Because this person may be a little more susceptible to get into a situation where they're triggered to take something inappropriately. But if I don't know that, I don't know to have that same level of caution. So it just goes to say that you need to be open and honest with your providers to be for sure that you get the treatment that is the safest for you with the least potential to have a negative consequence. Well, that's my topic today about, doctor, can I become addicted to my medication? Again, most of the time the answer is going to be no, but there are times you can become tolerant or dependent, and really what that needs is an open and honest conversation about that, what that means for you and your health.